To summarize all the findings we had in terms of the medical problems that we are seeing at this hospital, we found that the medical histories were incomplete. There was a failure to consider the obstetric history. There was disregard for surveillance warnings about bacterial colonization. There was misdiagnosis of diseases in these babies. They were caring for babies that were probably beyond their expected ability or designated level of care. There were unsafe delays in diagnosis and treatment of acutely ill patients. There were poor skills at resuscitation and intubation. There was poor supervision of junior doctors in procedures like intubation. There were poor skills in basic medical procedures like insertion of chest tubes. There was lack of understanding about basic things like respiratory physiology and how to mechanically ventilate a baby. There was poor management of common neonatal conditions like hypoglycemia. There was lack of knowledge about commonly used equipment in the NICU like Neopath and capnograph. There was failure to protect infants who were at risk, for example hemophilia, from trauma during intubation. There was a lack of teamwork and trust between the health professions. There were also statements given by many witnesses which point to serious resource and infrastructure deficiencies. And these specific concerns that were expressed by individuals include inadequate numbers of appropriately trained personnel in the unit, lack of training for assigned nursing roles, inadequate staffing and workload overload, poor plumbing and drainage resulting in the need for intensive cleaning in the unit. And this is a potential factor in Stenotrophomonas maltophilia infection because this particular bacteria thrives in water, and particularly in dirty water and bad water. There was poor environmental temperature control in the facility. There was difficulty in finding a doctor when the need arose. There was congestion at the medication cabinet and preparation trolley. There was lack of appropriate facilities for sterile preparation of drugs. Some high-risk infants should have been born and cared for at higher level institutions, but were born and cared for in this hospital. And there were delays in transfer of sick infants to higher level facilities when the need arose. So these are not things that we invented. These are statements given by people who work in the unit. Our conclusions of this panel, therefore, was that there was no medical evidence to support malfeasance causing death or injury in any of the 17 cases in the trial. Now, I've only presented you 7 of the cases, 7 of the 14 official convictions, but the others are similar. It's just nuances, changes of variation in the details, all right? Death or injury of all the affected infants were due either to natural causes or to errors in medical care. There were serious problems related to medical care of patients at this hospital. There were problems related to teamwork and interdisciplinary collaboration at the Countess of Chester Neonatal Unit. In summary, ladies and gentlemen, we did not find any murders. In all cases, death or injury were due to natural causes or just bad medical care. Lucy was charged with 7 murders and 7 attempted murders. In our opinion, the medical evidence doesn't support murder in any of these babies, just natural causes and bad medical care. Our full report will go to Lucy's barrister later this month, and then it'll be up to him in the courts to decide what next to do. So in closing, I'd like to thank you for attending this press conference. I hope our findings bring comfort and closure to the families of the affected infants, and our hearts and sympathies go out to them.